In this video, I'm going to show you 5 easy-to-do exercises for sciatica pain relief. Let's get started. Hi, I'm Dr. John Zielonka, a neurofunctional chiropractor in Ottawa, Ontario, Canada. If you've been dealing with sciatica, that sharp shooting, sometimes burning pain that travels down the leg, you know how frustrating it can be. Sitting hurts, standing hurts, walking can feel impossible. But here's the good news. I'm going to walk you through 5 simple, proven exercises that target the exact areas causing your pain. I've used these with hundreds of my patients, and in many cases, they start to feel relief in as little as 30 seconds. These exercises work because they hit the 3 key areas of the sciatic nerve that matter most. Let me walk you through how we're going to do this step by step. First, we start at the far end of the leg pain with the full path of the sciatic nerve. That means the foot, the leg, the thigh, and into the buttock. This is where most people feel the pain. Number 2, we're going to target the deep muscles in the buttock called the piriformis. That one muscle alone can put a lot of pressure on the sciatic nerve and make things worse if it's tight or inflamed. Number 3, lastly, we're going to go straight to the source of your lumbar lower spine, specifically the L4, L5, and S1 nerves. That's where the sciatic nerve actually starts. Be sure that you follow the routine as I show it. Here's why this order matters. By doing it this way, we're working to pull the pain back out of the leg and toward the lower back. That's called centralization. You want to bring it back to the spine. You don't want it coming down the leg. It's one of the fastest ways I've seen people get real relief. Now, let's get started with exercise number 1, the seated sciatic nerve floss. All right, number 1 is the seated sciatica nerve floss. So you're going to see here what Tanya is going to do is she's going to get in position and understand what a nerve floss is. This is not really a stretch. It's a phenomenal sciatic relief exercise. It targets the entire path of the sciatic nerve from the foot through the leg. So what Tanya's going to do, she's going to start, and you're going to see that what she's doing is she's straightening the leg, then look at the movement in the foot and the movement with the neck as well. And what we're doing is we're just moving the nerve back and forth. Think of if you're flossing your teeth, and what you're doing is you're not, that floss does not stretch, but that floss is simply moving back and forth. That's what we're looking for. It's what we call the most peripheral focus of the 5 exercises. It helps mobilize the sciatic nerve itself. You're going to want to do a good 5, possibly even 10 repetitions of this. You're going to hold for a good 5 seconds plus when you're doing this as well. Obviously, ideally, we're going to hit the affected side in your sciatica. You can certainly do both sides if you like as well, but the whole idea is we're literally flossing the nerve back and forth. That's why it's called a nerve floss. You can do this in a seated position, and as you can see, as she goes through the movement, okay, bringing the neck back, okay, put some tension on the nerve, the foot moving forward, put some tension on the nerve, but it's not stretching at the same time. It's literally flossing the nerve back and forth. So now let's take it a step further, and we're going to work on the piriformis muscle. This is what we call the Pirimormis Stretch. So you can see Tanya is putting her leg over the knee. She's grabbing behind the thigh. And in doing so, she's going to feel a stretch in the piriformis back here. The piriformis is the lateral, what we call the lateral rotator of the hip. So what this does is it's often that piriformis muscle often squeezes or irritates the sciatic nerve right in the buttock. She's going to hold this for a good 20, 30 seconds. I mean, sometimes it may only be 10. You may find it too difficult, but the whole goal is to hold this long enough that you actually feel the stretch ease up. So at this point in time, okay, she can let this go now if she's feeling the stretch easing up. Okay? And what she's going to do now this time, she's going to try this again, but if you can't reach behind the thigh, then just grab onto the shin. Okay? So again, we're going to do what we're capable of doing. So again, the sciatic nerve is really interesting with the piriformis. In about 80% of the population, that nerve goes right underneath that piriformis muscle. So if it is contracted or too tight, of course, it's going to put pressure in the other approximately 20%. That nerve goes right through the muscle. So again, if that muscle contracts, it can't help but put pressure on the nerve. So again, you're going to go through a good 5 to 10 reps of this if you can. You're going to want to hold it. Ideally, hold it till you feel the stretch actually ease up. That's when we know we've accomplished what we're trying to accomplish. You want to, it's not just necessarily count to 10 or 20 or 30. Let's actually hold it till the stretch itself eases up. That's what we're looking for. That's number 2, the piriformis stretch. All right, number 3 in our 5 easy sciatica stretches is our knee to chest stretch. So this is a really easy one. Almost everyone can do this. You can be lying flat on your back. You're simply bringing the knee up to the chest. So now that we've loosened up the piriformis, we're going to shift that focus slightly higher into the lower spine. So the knee to chest stretch helps open up the low back. It reduces that tension around the spinal joints, and that can take pressure off that L4, that L5, and that and the S1 nerves, the main spinal nerves that feed into the sciatic nerve. So again, when we're doing this, simple pulling the knee towards the chest, we're going to hold this for a minimum 10, likely 20, maybe even 30 seconds. We actually want to feel the stretch ease up. And of course, don't forget to breathe during all of these exercises. Often people, for some reason, forget to breathe. They hold their breath. That is not good. We want to actually ease up the entire body here. So again, you're going to do a good 5 to 10 repetitions of this, ideally on each side. We want to maintain that balance, not just necessarily on the affected side of the sciatica, but ideally both sides. So go back and forth both sides. That is the knee to chest stretch. Number 4 is the Cat-Camel Stretch. So with the low back more relaxed now after the first 3 exercises, now we're going to get the spine moving. So the Cat-Camel Stretch is great for improving flexibility and motion in the lower back. That can reduce stiffness. It can help calm down the irritated spinal nerves that trigger the sciatica leg pain. So in the Cat-Camel, you can see first Tanya is rounding the back, and you go to the point where you, again, feel a good stretch and that you're actually bringing mobility back into the spine. Again, you're going to hold this for a good 10 seconds minimum. You're going to breathe while you're going through all this. And then the reverse movement of that is now you're getting into that camel movement where you now want an arch in that back the opposite way. You're going to go back and forth between these two, the Cat-Camel Stretch. It brings mobility back into the spine. It's going to ease things up. You notice we've now worked our way from the sciatic nerve and more back to the center of the spine where this originates in the first place. Again, remember to breathe. Again, we're going to do ideally a good 5, maybe even 10 reps of this, and this is going to bring mobility back into the spine. And number 5 is the prone lumbar extension. So now that we've loosened and mobilized the spine, we're ready for the most important move in the routine, the prone lumbar extension. This position helps shift pressure away from the discs in your lower back, which can reduce sciatic pain, and it can actually help promote centralization. We talked about that before. With sciatica, we want to take the pain away from the leg and bring it back to the back, and then eventually, of course, get rid of it from the back. So you're going to see here, Tanya's going to start, and what she's simply doing is extending the lumbar spine. So when she does this, right now she's on her forearm, she's bringing some extension in there. This is something where, again, you're going to hold this for a good 10 seconds or so, possibly more. You're going to go to the point where you feel it, but not that you're actually creating any pain. So when it comes to any of these exercises, that old adage, no pain, no gain, does not, never has, never will apply to what we're doing here. And you certainly don't want to ever recreate any of that leg pain, especially in sciatica cases. If you're doing that, you need to back off that right away. So we're going to go through, again, a good 5 to 10 reps. As we do this, again, remember to breathe. So we're simply extending the lumbar spine. We're arching back like this to the point where we feel a good arch, where we feel it, but we're not creating any pain in through there. We're going to remember to breathe. Now, this one, Tanya's going to do a bit of a more advanced move. You can get off the forearms, and you can actually straighten the arms as well. Again, if you're in some severe sciatic pain, this may be a bit too much for you. Okay? So again, we're going to do this to tolerance. We're going to take this to the level that you're at with all of these exercises. You need to pay close attention. Form needs to be really, really good. And again, each individual can be slightly different. So what you want to do is pay attention to your body. If anything creates or recreates any of this pain, you need to back off those right away. And of course, hopefully you are under the care of some good health provider who understands all this quite well. When you start this exercise routine in the order that I gave you, you may start to notice relief of your sciatica nerve pain quickly. Each exercise targets a different part of the sciatic nerve, and together they help reduce pressure, improve movement, and calm the nerve fast. You may start to feel less pain in your leg, more flexibility, and even a noticeable difference in how your back feels, especially if you stay consistent with it. If you're ever unsure about doing any of these exercises, be sure to check with your doctor first. And if this routine gave you any relief, I'd love to hear from you. Drop a comment below. Let me know which exercise gave you the most relief. Was it the sciatic nerve floss or the prone lumbar extension? If you found value in this video, like it and share it with someone who might need it. And remember to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. The next video you should watch is this one because it takes you through a step-by-step non-surgical treatment protocol for conditions like sciatica, disc bulges, disc herniations, and lumbar stenosis. Please go watch this video next.